Hello everybody, Andrea Twarowski here with Dentalelle Tutoring. So I have never actually talked about this either, which is funny because I know if I was a new dental hygienist or a dental assistant even, I would kind of want to know what it's typically like in a dental office. So I have been a dental assistant, I've been a dental hygienist, and I've been a restorative hygienist now for a couple years. But let's just talk about dental hygiene because that's what I do primarily, and I do restorative hygiene also. But if you're a new hygienist, you just probably don't know where to start. And as a hygienist, you don't often get a chance to be an internship at an office. As an assistant, you have that chance because it's normally part of school. But as a hygienist, you don't often get that chance. So if you've never worked in a dental office before, you might just have no idea how to get started. In clinic and school is one thing, but offices run very differently, right? So I'm just going to keep it simple, and you may think I'm being silly and too simple, but this is how it is, right? So when you walk into the office, okay, it's a good idea to always look through your charts. So look at your schedule for the day and look through your charts to see sort of what types of patients you are seeing. What I like to do is I like to look in the schedule to see if these patients need x-rays, if they have a recall exam, or if it's only a perio appointment. So I make notes usually on a sticky note, and then I put it on their chart, so then that way I know what they need at each appointment. Plus, I like to make note of the time. So if I'm seeing patient number 1 from 9 in the morning till 9:30, I like to make a note 9 till 9:30 because every patient is different. It could be a half an hour, it could be 40 minutes, it could be 45, it could be an hour. So I don't want to confuse myself and think that I have more or less time for a patient. So I'm either going too quickly and then I'm done early, or I'm just taking my time thinking I have more time, but I didn't sort of look things through properly. So that's just something that I like to do. And I like to check also in the chart if they need a probe. So in most offices, you do a probe every year. In some offices, they want you to do the PSR at every appointment and then still do the probe once a year. So check to see what the office policies are for you. I'll leave that for another video because I could talk about that for a half an hour because it does depend on the office. So that's just kind of something that I like to do. Another step that I like to take is, depending on the office, is I like to set up at least 3 trays ahead of time. I have been in offices before where we didn't have enough trays ahead of time, so I would just have to set up my trays per patient. I've been in other offices where we each had like 10 trays and 10 instruments to ourselves, so then I would be able to set up the trays for my morning patient and patients, and then after that, then I would set up enough trays and have everything organized for the afternoon. So it does depend on the office. So you might be wondering, well, what do you need on your tray? So of course you need your instruments. So some offices may have instruments wrapped up. They may have it depending on if you're seeing a child patient or an adult patient. They might have instruments in another area. They might have instruments in your room. So check to see where the instruments are. So I put an instrument kit on the tray. You will need the air water syringe tip. You will need the saliva ejector. You will need some gauze. You will need some polishing paste. You will need a handpiece and some floss. So I think I got everything there. So that's how I like to organize my charts now, or trays. Now, depending on the office though too, you might be polishing every single patient, or some offices you only polish at the recall exam. So if I know I'm doing a perio appointment, I won't put the handpiece and the prophy paste on the tray if I know I'm not polishing. So I just kind of look to see what I'm doing, and then I set up my trays accordingly. And don't leave the trays sort of on the counter beside you, because if you think about it, you want to keep them as clean as possible. I have been in offices before where I had my own like cupboard unit, so I would put my pre-made trays inside there. I've had other offices where there's not enough room for that, but I could put the trays sort of up high over here. But sometimes you just simply don't have enough room, so you might not be able to organize your trays ahead of time. So think about all of those things. But if you can, it does help to organize them ahead of time, because even if you're 5 minutes behind, that 5 extra minutes that you don't have to take looking for the handpiece, looking for the suction, looking for the air water syringe tip, you just have that on your tray. So all you have to do is wipe everything and then put the tray here, and then you're all set, ready to go. So that's just something that I like to do. And I find that that helps me stay on time a little bit more. And it does help me to look through the charts at the beginning of the day, so I just kind of have an idea of what I'm doing. So that's what I like to do first. So then I like to seat the patient, of course, as soon as they arrive. So if their first appointment is 9 o'clock, seat them at 9 o'clock. Not 9:05, not 9:10. Don't just take your time, seat them at their appointment time, because if you start late, it will just sort of throw off the whole day, and you don't want that. So bring the patient back, ask them if there's any changes in their medical history, and take it a step further and say, are you on any new medications? Do you have any new allergies, and have you been to the hospital? Because some of them might say, well, there's no changes in my health, but then you will ask them, well, have you been to the hospital? And they'll say, oh yeah, I did have a heart attack about a month ago. That's pretty important, right? So that's why I like to ask things a little bit further. And then ask them if there's any tooth concerns. Do they have any sore teeth? Do they have any sensitive teeth? If they say they have a chipped tooth, you might have to take an x-ray of that tooth depending on the office, right? So you need to know if there's any tooth issues ahead of time. But I'll probably talk about that also in another video, because I could talk about that forever. So those are the main things that I like to ask them. But then I like to let them know what the appointment's for. So I will say to them, you are here today for your cleaning and checkup. You aren't due for any x-rays today, so I will do the cleaning first, and then the dentist, he or she, will come in afterwards to do the checkup. Because some of them might say, oh, I didn't know I was in for a cleaning today. I thought I was having a filling. I don't want my teeth cleaned today. Who knows, right? Or they might go, oh no, I'm pretty sure I'm just doing a cleaning today. Like, I don't think I have the checkup with the doctor because my insurance doesn't cover that. So, it's just things to look at. So I like to let them know what's happening. And then I do ask them if they have any questions before we get started, especially for kids. I like to ask them if they have any questions before we get started, because some of them might go, is it gonna hurt? Because they could be thinking this the whole time. But if they ask you ahead of time, then you can say, and you know what, it's not gonna hurt. Like, we're just gonna polish, clean the teeth, that's it. So I do like to ask if they have any questions to start. You don't have to, but it's just something that I like to do. So then you, of course, sit the patient back to clean their teeth. And I do also say to them, if you need anything at any time, please just let me know. So then that way they know that if something hurts them, if I'm applying too much pressure, if they're uncomfortable, that they can let me know. So that's just something that I like to do. So I will clean the teeth. If I feel like I need to use the piezo scaler or the ultrasonic, then I will let them know so that they're not surprised by having all of that water in their mouth. So I will say to them, oh, and you know what? You have a little more stain in some areas. So I'm going to use something that does spray out a little bit of water. It's called the ultrasonic. It just sort of sprays out some water as I'm cleaning, and it makes things nice and, smooth and shiny. But if you don't like it or something, just let me know, and they like to hear that. So I will mention that. And then after I'm doing the cleaning, if I'm doing the polish afterwards, I'll say, okay, well, now the cleaning is done. I am going to polish the teeth, and then I'm going to rinse, and then I will let the dentist know that you're all set. So after the cleaning, I polish if they're due for a polish, and then I floss after that. And then I always check my work after that, especially the lower interiors. Blow air to see if you left any calculus. If you did, that's okay, but make sure to clean it off. That's normal. I always leave something there because it's hard to see sometimes, right? And if the gums are bleeding a ton, it does help to be able to see. So then after that, I will say, well, I just have to let the dentist know that you're all set. I will be right back. But then I also say the dentist might be a moment or two would you prefer to sit up or stay the way you are? So then that way, if they want to sit up, they can. Maybe they want some water. Offer them some water. You know, be nice, right? And I will also ask them if they have any questions. I tend to let them know that I am letting the dentist know that they need a check first, and then I come back and then say, do you have any questions? Because I find that if I ask them first, then they might have a lot of questions, and then I'm thinking, oh shoot, the dentist still doesn't know that I need a check, but now I'm behind because the patient has had so many questions, right? But if you let the dentist know first, because they'll probably keep you waiting a couple minutes, you can answer the patient's questions while you're waiting. So that's just kind of something that I like to do. And then after the dentist comes in to have a look, or I should say as they're coming in to have a look, I like to set out a pair of gloves for the dentist and a mask. So I say, you know, here you go. And then I let the dentist know how things looked. So I will say, Peter had a little more plaque this time, but the gums seem to be bleeding less. His highest pockets are a 4 millimeters, the upper left-hand side mainly, and we see Peter every 3 months. So I will sort of let the dentist know what I did and how things look. It just makes you look professional, right? It makes you look good. And the patient knows that you two sort of talk, right? Like you and the dentist, you know, have a good relationship and you talk. They like to see that. So that as the dentist is checking, they may ask you to take notes. So if they see a cavity or if there's notes that they want you to make down, write the notes. So always sit near the chart with a pen in hand. I have seen too many people, as soon as the dentist come in, they get up and leave the room. You can't do that. You have to stay in the room with the dentist and be prepared to take notes. Some of them talk fast, so be prepared to write quick notes. And if they say that the patient, let's just say, has a cavity, ask them how much time, you know, afterwards they need to fix the cavity. So the dentist may say, oh, I see a 4-6 occlusal that needs to be done and a 4-7 MO that needs to be done. Write those in the chart. And then you probably have to write on a separate sheet to let the receptionist know that they need another appointment. So write that down and then ask the dentist how much time he or she needs for that, and then write that down so then that way the receptionist knows, because there's nothing worse in not thinking to ask that. And then you go up to the front and the receptionist says, well, how much time does he need to fix those? And you go, oh, I don't know. So then you have to go ask the dentist, who is probably now with another patient and doesn't want you to bother him or her, right? So it's good to ask these things first, okay? So that's what I do. And then after everything, I do ask the patient again if they have any other questions, because if your patient and the dentist are talking about, let's just say, a crown that needs to be done, you know, the patient may have questions for you, but they didn't want to ask the dentist. So that's why after the dentist leaves, I do ask the patient again, do you have any other questions? They may say no. Okay, awesome. Give them a toothbrush, a floss, and toothpaste, and then say, okay, you are all set. Let me walk you out front. Walk the patient out front. That looks awesome. The office loves that, okay? Walk the patient out front. I don't want you simply saying, okay, see you later, buddy. No. Walk the patient out front. Some offices ask you to have the patient have a seat, and then the receptionist calls them up, or sometimes you just take the patient up to the front desk. If you see that the receptionist is handling other people, then just let the patient know to have a seat and say, you know, she's just dealing with a few other people. Have a seat, and then I will bring your chart up front, and she will call your name as soon as she's ready for you. You know, I have seen people walk the patient up front and say, have a seat, but then they don't let the receptionist know that you're done, right? So always sort of talk to the receptionist, talk to the patient, and let them know, you know, just have a seat until they call you up. And then that's it. And then you walk to the room, you clean up, and then you set up for the next patient. Now, you may have to post things in the computer. You may be taking your notes in the computer or on a paper chart. But I'll leave that for another video because I could talk about that a lot too. But I do hope that that helped with the whole how appointments work. I don't know why I didn't talk about this sooner because it makes sense to kind of want to know how, right? So I'm sure you have questions about this one. So if I left something out, let me know. And I'll see you guys in the next video.